Hi, everyone. This is Sarah. I am going to be talking to you today about Take a Clean Breath, how you or a loved one can stop using tobacco, vape, or marijuana, etc., whatever you choose. I know this is probably not everyone's favorite topic just because there's a lot of emotions around tobacco use, and we do tend to kind of be harsher on it, but there are some health concerns. And so hopefully after today, you can take away some things that you can do to help you yourself move towards a healthier life and stopping tobacco, or for your loved ones, how to help support them and come alongside them to help them stop tobacco. So this is just a disclaimer from our company as far as this webinar is for educational purposes, and it's generic information. You should always talk to your provider regarding any medical condition. They may have more individualized advice for you and be able to kind of tailor things more to you. Um, so, just a little disclaimer today, we're going to be talking about myths and facts about tobacco, effects of nicotine on your body. Along with that, we're going to look at hookah, e cigarettes, and also marijuana. Um, and then how to assess readiness to change and figure out, are you ready to take this next step and preparing to stop, and then different treatment options for helping you stop tobacco for good, as well as the other products. So just something to think about. If you can grab a piece of paper or something and consider, why do you use tobacco? And if you don't use and you're here for your loved one that uses, why do you think they use tobacco? Is it when they're stressed or you're stressed, out of boredom, part of the daily routine? Is it something that is done with other people? So there's that social aspect to it. Just enjoy it, or maybe don't like how you feel when not using it. All legitimate reasons, but kind of thinking about that, because your ability to stop is going to be based off of why you're currently using. Um, Usually, our motivations to stop need to be greater than our motivations to keep using too. So some tobacco busting myths. So there's just some rumors and myths around tobacco that hopefully we can kind of debunk here. So these are all myths, just for re-clarifying here. Myths: light cigarettes are made from less harmful tobacco than other cigarettes. They're less addictive than other cigarettes and healthier to use. Uh, in fact, there's no such thing as a light tobacco. A lot of these are based off of how machines smoke tobacco or smoke cigarettes, and that's not exactly how you smoke cigarettes. It kind of depends on how you smoke the cigarette. If you take in long, deep breaths versus short breaths, do you smoke the whole thing? Do you cover up the vent holes that are on the light cigarettes? If you're doing that, that's going to kind of defeat the purpose of the vent holes. And it can be just as harmful as other types of tobacco as well. Other myths, these ones around weight gain and stopping tobacco use. Um, Smoking really speeds up my metabolism, and if I quit, I'm going to gain a lot of weight. Being overweight is really just as unhealthy as smoking, so I'd rather smoke. I've heard that rationale a good bit. In reality, you stop in to think about it, you take a guess, kind of think of something in your head. How much weight would a normal weight person have to gain to equal the health risks of smoking? And if you have that number in your head, 80 to 100 pounds. It's probably a good bit more than what you're thinking. And then what is the average weight gain of someone who actually stops using tobacco? And kind of thinking that in your head, 7 pounds. Not as bad. Then what's the number one reason people gain weight when they stop using tobacco? They start eating more. So it's becomes the new coping mechanism. Kind of when you stop using tobacco, get that hand to mouth motion. Um, Tobacco cessation is the number one thing you can do to improve your overall health. And then we have spit tobacco or chew. Some myths about it. Use is rare. It's safe to use. Have heard that it's safe to use and it's less addictive. Not so. Use is on the rise. A lot of people like to use it because it's easier to hide. Has a really high nicotine content. So Copenhagen and Scroll are the best sellers, and those have the highest nicotine content of all of them. They contain sugar, dirt, and grit that can wear down the teeth enamel and gums. If you're trying to prevent infection, that stuff that's wearing down that teeth enamel and gums, those can help really your teeth enamel and gums help prevent infection. So it's not going to help as far as just the overall immune system. And then nicotine replacement aids and meds are recommended to help stop with spit tobacco and chew tobacco. And there's options specific for those that help with that too. All right, myths about dependence. I only smoke a few cigarettes a day, so I'm really not dependent, and it's just a habit for me, so I can stop whenever I want. I tell my kids not to smoke, and I don't smoke around them, so they won't want to start themselves. So it's okay because I at least don't try to smoke around my kids. All right, facts here. One of the most addictive substances is tobacco. Percent of alcohol drinkers who become dependent upon alcohol is around 6%. Percent of tobacco users who become dependent upon tobacco is around 94%. So much more addictive. So true or false? Fewer cigarettes or dip you equals less dependence. It really depends on how you're smoking and how you use the cigarette, how you hold the dip. It depends on the tobacco you're using, your genetics, and your sex, but that's false. Just because you're using fewer does not mean that you're less dependent. True or false, women become more dependent on tobacco than men. That's actually true. Women tend to have a more difficult time stopping tobacco use. So it doesn't mean it's impossible, but it is harder. And then true or false, children of tobacco users are twice as likely to use tobacco in the future. It's actually 3 times more likely. So um, 3 times more likely just by having a parent that uses tobacco. All right, we're going to look at hookah. So a lot of people are using hookah now. I know I've heard when I was in college, even people would come up and be like, "Oh, hookah's better for you. It doesn't really have any harmful effects or anything like that." Well, this is a hookah. This is what the hookah looks like. You might have seen one. Put the stuff in the mixture in the top, and then here's the water bowl. You get this vapor that comes through the pipe, and then you get it out of the mouthpiece. So hookah's at least as much of a health risk as cigarette smoking, if not a greater health risk. It can actually be worse for your health. People who use hookahs may absorb more toxic substances from the contents than smokers. So you can inhale 100 to 200 times the amount of smoke compared to a single cigarette. I think a lot of people think, oh, hookah smells fruity. Hookah, it's just water vapor. So it really doesn't have any problems. That's what a lot of people I've heard. It's what a lot of people say, a lot of people think. Um, Water from hookah cannot actually remove the toxins from it. Non-tobacco based hookah still contains carbon monoxide and other toxic agents that can increase your health risk. And it's going to impact you and others you're smoking around. So it's not just water vapor, and it can pose a health risk both for you and those who get that secondhand smoke. Which kind of leads us into e-cigarettes because it's kind of a similar principle here. These came out in 2007. I believe it was more so something that they thought would be another helpful nicotine replacement aid. Um, it's an electronic use battery and an atomizer to heat a solution, which, when inhaled, delivers vaporized nicotine into the user. So kind of similar to that hookah. Those around e-cigarettes users can also inhale the vapor into their lungs when the user exhales into the air. Again, very similar. There is not any evidence that supports the use of e-cigarettes as a safe or as a tobacco cessation aid. Has unknown levels of nicotine. It is really rising in high school students, which is kind of alarming. 1 in 5 high school students uses e-cigarettes and can actually lead to tobacco use versus the other way around as far as helping you get off of tobacco. While e-cigarettes have fewer toxic chemicals than those in cigarettes, it can still have harmful chemicals other than nicotine, including heavy metals such as lead, volatile organic compounds, among other cancer-causing agents. So still has those cancer-causing agents in there. So unknown levels of nicotine content, but 1 Juul pod, like the nicotine content in the e-cigarettes has doubled in 5 years, and 1 Juul pod contains about 20 cigarettes worth of nicotine. So it can have a good bit of nicotine in there, and it can be kind of alarming as far as that goes, and make stopping actually kind of harder. Other drugs such as THC are commonly added to vape liquid, so that can make it pretty dangerous. And We'll talk about marijuana and THC in a minute here as well. It's unknown exactly how much nicotine, among other substances, are in each cartridge of those e-cigarettes again. We don't really know. There have been some short-term changes in the lungs from like those caused by smoking, and long-term effects are not clear. So flavorings and things like that can get added into that mixture. Those flavorings are approved by the FDA to go through our digestive tract, not into our lungs. So we don't really know what's going to happen when it goes into our lungs. We do know 5 times more likely to get COVID with e-cigarette use. Unknown long-term consequences. Some of the long-term consequences that we have seen, thousands of cases of severe lung issues and respiratory distress. Children being poisoned by the vape liquid, vaping use causing bleeding in the lungs and lipids in the lungs. And many people have been placed in an ICU and medically induced comas related to that e-cigarette use. Many others have died related to it. So hopefully you're getting not a great alternative to cigarette use. And then what about marijuana? Marijuana is this other kind of up and coming. We're seeing a lot of it with medical marijuana getting approved around the country. So marijuana is a term for the chemical, like specific chemical combination, because it comes from the plant cannabis. It's the type of plant which marijuana is derived. Cannabis sativa is the main type of cannabis used for marijuana. And that marijuana is going to refer specifically to the THC. There's hundreds of different chemicals within this specific plant, but we're specifically looking at THC and CBD with marijuana. And then the alternative of marijuana that has very little THC is considered hemp. So it's the same plant. One is considered marijuana, one's considered hemp, just based off that THC content. So as you're looking at marijuana over the past about 30 years, the way I've heard it said, today's marijuana is not the marijuana that you would get in the 70s. It is, if you look at this THC content, it was 3.96 back in 95, and just as of 2019, it was up to 14.35%. So that's about a 3 to 5-fold increase in THC content over the past year, 30 years. CBD kind of alternates. So if you kind of see like as CBD goes down, that THC is going to increase. So again, the hemp is going to have more CBD and less THC. But that being said, it is a psychotropic drug, so it's going to impact that brain. And I apologize for the wordy slide here, but just kind of looking through this. After tobacco and alcohol, marijuana is the most used addictive drug. You can overdose with marijuana and have withdrawal symptoms. Symptoms of withdrawal include irritability, trouble sleeping, decreased appetite, anxiety, some cravings. People get the munchies a lot of times with marijuana. About 1 in 10 people who use marijuana will become addicted. If you're looking back at the slide a couple slides ago, about 6% of people with alcohol will develop alcoholism. We're looking at about 10% with marijuana. So it's more than alcohol even. It can impact brain development among adolescents and young adults. In fact, when taken at a young age, marijuana can lead to an 8-point reduction in IQ. And that 8-point reduction does not go away. Like it doesn't recover after if you stop using marijuana down the road. You can't recover that 8-point loss. So that's pretty significant. Regular long-term use can lead to ER visits with severe nausea, vomiting, and dehydration. This is cannabinoid hyperemesis syndrome. And I used to work in a hospital. We saw this a good bit. People coming in with lots of vomiting. Never looked pleasant. Looked pretty miserable. So don't want that. I did kind of skip it. It can lead to coughing and breathing problems if it's used frequently enough. Long-term use is associated with temporary hallucinations, paranoia, can worsen symptoms of schizophrenia. Edible forms are absorbed more slowly and may have more THC concentration. So if you have something with a large amount of THC, and it's not absorbed as quickly, you might take more just to try to get that impact and feel that impact from the marijuana. And now it's getting absorbed more slowly. And now you have tons of THC in your system, and you didn't mean to have that much. It's just because it's absorbing slowly and it has higher THC concentration on top of it. Um, Marijuana users are more likely to report lower life satisfaction, poor mental health, poor physical health, more relationship problems. So there's some concerns with mental health and marijuana use. If it's used while someone is pregnant, it can lead to problems with the child development and after pregnancy and during the pregnancy. And it influences coordination with driving and has can slow the reaction time, which kind of leads us into this slide on medical marijuana. Even though Ohio has approved medical marijuana, um, and marijuana is approved for medical use, the FDA has still not approved the plant for medical use. So the FDA regulates drugs in America. It is not federally approved. It is not a federally approved medication. We have dispensaries in Ohio for where people go to get medical marijuana. But again, that THC content can vary, and it's today's marijuana is not marijuana like it used to be. So THC content's going to vary depending on what you get, what form of marijuana you get, and when you get prescribed that, it's kind of when you go to the dispensary that you've decide what kind of form of marijuana you're getting, and um, THC contents could vary. Um, there are some medications that even for a long time, even before medical marijuana was approved for Ohio, there have been some medications derived from THC and CBD used for specific conditions. So we take the extracts from the plant. So that could be the leaves, it could be the seed. Extracts could come from multiple places, but like the roots too. But those extracts could be in things like Marinol. Marinol is an appetite stimulant that's been used for some cancer patient to help kind of increase their appetite. Really works really well for that. Um, Research is still being done into other specific conditions. Smoking and combustion, though, is not a form of medical marijuana available in Ohio. So that is not one of the types of medical marijuana that's going to be available. And you have to keep in mind your legal certifications. So Department of Transportation does not allow medical marijuana use. Even if you have a medical marijuana card, they do not allow medical marijuana use. The city of Dayton also does not allow medical marijuana. If you use medical marijuana and you test positive for marijuana on a random drug test, it doesn't matter. You're still going to suffer the consequences for that, um, despite having that medical marijuana card. It is not allowed by the city. You could lose your license. It's going to follow underneath the drug rehab law for the city if it happens twice. Again, that disciplinary action will be taken. So, key takeaways when you're looking at marijuana, there's still research being done on some of these extracts. Marijuana can be addictive. Even medical marijuana is not without its side effects and can impact your health, and it can lead to a substance use disorder. We will talk about some different behavioral strategies specific um, with marijuana as far as like same kind of pathway with tobacco. Some things are going to work for marijuana for tobacco that do not work for marijuana. So real cost of using tobacco though, when you're looking at why stop, one of the big impacts for people is just how much is it really costing you. Average cost of tobacco was before recent price increases and inflation, $7 per pack. And from what I've understood from different people, it's closer to $9 a pack now. Um, so, I mean, this is going to be even higher, but with that $7 per pack alone, that was $2,555 a year if you smoke a pack a day. If you're up to 2 packs a day, that's $5,110. Even if you're only at a half a pack a day, that's still over $1,000. So what would you do with that money you saved any year from stopping tobacco? That could be a really nice vacation. It could be helping with extra money going to payments on other bills or whatever. It could be a really nice spa day, whatever you want, but that's a lot of money to be able to save. Um, and kind of on top of it, if your salary is $18 an hour, and this is based on that $7 per pack amount, that's about a month's salary for you. Or if there's 2 users in your house using a pack a day, that's 2 months of your take home pay a year going to buying tobacco. And that's at just 18 bucks an hour. Nicotine. So, really looking at nicotine and the drug of nicotine. So, it does not cause cancer, but what the way nicotine impacts us is it is the part of tobacco that's going to be addictive. It causes feelings of well-being and calm, and kind of makes you happy. It's that dopamine's that drug that makes you happy, and it triggers that dopamine release. So nicotine's going to kind of connect and help release more dopamine. And high it's in high levels in smokeless tobacco. So it's nicotine's higher in that smokeless tobacco, e-cigarettes and cigars. So one cigar is about cigarettes worth of nicotine. A lot of nicotine in cigars. Kind of the health concerns specific to nicotine is that nicotine causes blood vessels to constrict, and that can create blood pressure issues and heart conditions and heart disease concerns. Um, it also may interfere with male sexual performance. Um, Common withdrawal symptoms of nicotine: fatigue, irritability, headache, hunger, difficulty concentrating, insomnia. One of the other, I mean, kind of looking at that dopamine release, if it's creating that feelings of calm and kind of helping with that stress, it can create withdrawal, can kind of lead to stress and maybe some depression because that dopamine's not released as high. Um, but how long the withdrawal takes is usually about 1 to 2 hours after you use before that withdrawal takes, which is why a lot of people smoke every 1 to 2 hours after stopping. There are some things to help combat withdrawal symptoms, and you should expect them. One of the big things is that you can start training your body to withstand longer and longer between periods of using tobacco. Um, Again, we tend to look at it as like either you're smoking or you're not, you're using tobacco or you're not. If you can go longer without having to use that nicotine, it's going to help wean you off and help with some of those withdrawal symptoms. Um, just help gradually manage the withdrawal symptoms and go farther and farther apart. And we'll talk about that a little bit more in a minute. So regardless if you're the one trying to stop using tobacco or if you have a loved one, this would be a good exercise to go through either for yourself or kind of with your loved one or the person you care about that's using tobacco and you want to help. Um, this is a decision-making worksheet, so kind of looking through what are the good things about using tobacco? Why do you use? Like you're using it for a reason. There's reasons you keep going to it. Um, what are those good things that you find in it? And then what are the not so great things about it? Like, what are going to be those things that you know that are not great about using tobacco? What are the good things about stopping tobacco? What are you going to gain from having tobacco? This could be like more money, more time, things like that. And then what are the not so good things about stopping tobacco? And I mean, honestly, for some people, they're like, hey, I get a break. Like, I kind of have a cop out as far as like I can just go outside and take a smoke break, and I can take a step away, and I don't feel like I can take that step away if I don't use tobacco. Kind of recognizing some of those. It's important to go through that decision-making process as far as like, do your benefits out this is kind of like a cost benefit analysis. Do your benefits outweigh the cost of using tobacco? And then your best motivator should always be your health. The second best is your family and helping with your family's health. Tobacco shortens people's lives by about 15 years on average, but you need to be ready to stop. If you're not ready, that's okay. We're going to look at the readiness ruler in the next slide, but you need to check and make sure you're ready. And then make a plan and a commitment to change. Determine what your motivation is to stop, because again, you have to have that motivation to stop. You have to say, hey, my benefits of stopping are better than my risks and the costs of not stopping. And then setting a date. Um, Getting that date together. When are you going to stop? Gathering your tools and getting support and encouragement. It is important to have that support system and that encouragement. We'll talk about that in a little bit more. We're going to talk about some of the tools available to you, um, but removing your obstacles too. So, getting rid of anything that's going to remind you of cigarettes or spit tobacco. So, it could be your like spit jar, your bags, it could be your lighters, the cigarette holders, anything that's going to remind you of that, getting it out of the house so that it doesn't remind you, removing any obstacles in your way, um, preparing for the challenges of stopping and cessation. And I continue to use the word stop because I learned this from one of our nurse practitioners within our company. But a lot of people look at it and say, hey, I failed quitting so many times and I've tried quitting so many times. But how many times have you successfully stopped? And odds are you've probably stopped very many times. And we'll talk more about that in a minute, but it's a positive way, a more positive way of looking at it. And then there's the readiness ruler. So how important is it for you right now to make this change? Are you ready? Um, is it and it might not be that important for you right now just based off of where you are in life. But this is looking at the immediate more a moment and being honest, like how important is this to you right now? And it might be that you need to hold off on this, but you should make sure that you're ready to change if it is important to you. Um, and how confident are you that you can make this change? There is a large mental aspect as far as like being ready and setting yourself up for success. And so making sure that your road to success is successful. Um, and then there's the behaviors of smoking. So there's 6 different components of that behavior. It's that actual physical dependence, that nicotine addiction. There's psychological aspects to it. So like we talked about, like some of it's, um, having that cigarette and having those feelings of calmness with it. Um, Feeling like you need it. It's kind of like that best friend in your pocket that it's there for you. It's there. You can pull it out whenever you need it. And it's your coping strategy. If you're stressed out, you can always go to it. It's always there. And so there's that psychological aspect to it. There's that hand to mouth oral aspect of having it in there and that habit. Um, there's kind of a manipulative aspect to it too, where, well, again, I can just head out and go get my smoke break here. There's a social aspect to it. Going and hanging out with your friends and smoking because that's your smoke break. And then there's a breathing aspect to it too, where some of what could be causing some of that stress relief is deep breathing. A lot of times, if you're smoking, you're breathing deeply. You breathe in, you hold it, and you let it out. Well, these are the same kind of things that we know already help with stress relief. But deep breathing is going to be an aspect of that too. So then we get into nicotine treatment options and treatment options for tobacco. And then this is also going to kind of apply to hookah because some of those chemicals are going to be in there. Um, Marijuana, some of it is not. So there's nicotine replacement aids. So talk to your provider about how long to use these and use the nicotine replacement aids. And there's generic recommendations, but you can kind of tailor that with your provider. Patches usually take about 2 hours to work. You can put it on before going to sleep because if you try to put it on right in the morning and you're somebody who has to have some tobacco first thing in the morning, that might not work so well. So you can put it on to sleep so it's kind of working full force when you get up. Gum, it usually starts with 4 milligrams first, then goes down to 2 milligrams. But gum needs to be parked. It is not chewing gum. You can't just chew it regularly. So chew it, park it in your gum. Zen pouches are for those who tend to dip or chew. It's about 15 in a can. It's a nicotine replacement, but similar kind of thing. There are herbal kind of supplement things that you can mix with your current tobacco too, where it's like mint or other herbs that are not going to be as harmful for your gums. Those can help too, as far as just weaning you off of that nicotine and off that tobacco. Um, Kind of mix it separately. Nicotrol inhaler is a prescription. It looks like a cigarette holder. You smoke each cartridge twice. Um, Much more similar as far as smoking a cigarette. So similar kind of thing, but it's an inhaler. Nicotine nose spray works the quickest. There's about 100 squirts per bottle. So if you just need something quick to help kind of take the urge away, it is the fastest and it does burn some though. Um, if you are considering doubling up or wanting to double up, just talk to your provider because again, Nicotine's going to constrict those blood vessels. It's going to make everything kind of constrict. It's going to can impact pressure, so you don't want to have blood pressure problems on top of everything else. Um, Medication options. So Chantix and bupropion are the two main medications used for nicotine cessation or tobacco cessation specifically. Chantix is very similar to nicotine, but it's not addictive. Um, Clonidine is a blood pressure medication, and it has a calming effect. Bupropion, that's an so kind of backtracking to Wellbutrin, Zyban, or bupropion, all the same thing. That was initially an antidepressant that they found a lot of people on that antidepressant actually stopped using tobacco on their own. They weren't trying. So that one tends to work well. If stress or anxiety are big concerns, or depression, again, nicotine releases that dopamine response. And if that's one of the main reasons you feel like you tend to use, having those on board, talking to your provider, maybe having those on board before you even try to stop can help kind of address that main issue, to help you work towards stopping. Nicotine can be used with all of these. Nicotine replacement aids can be used with all of these except for Chantix, because Chantix kind of acts like nicotine in the body, like it's triggering to the same spot. So it's not going to work with the nicotine replacement aids. It won't be effective with those. Non-medication treatment options. So no medications are going to be available to treat marijuana use disorder. So there's not really anything for that, but all of these behavioral supports ideas tend to be pretty effective for them. So this is going to apply to any of these. You can do cold turkey, which is stopping completely with no aid, nothing. Has about a 4% success rate, so might not be your best bet, but can try, certainly can try. Warm turkey is cutting down, slowly going from 2 to 1 and trying to think of areas where you can cut off and cut back on tobacco. So maybe not using in specific areas, not trying to avoid certain times of the day. That's another technique. We do have a brand switching guide for both regular cigarettes and dip, if you want help with that. Hypnosis does work for some people, so that can be effective. Acupuncture, again, can also be effective. Cognitive behavioral therapy is working on behavior change within a structured program. So it's a lot of what we work on with our tobacco cessation program within our company. Big encouragement, though, is a lot of times when you're taking out tobacco, when you're taking out nicotine, it feels like you're deprived. So adding things back into your life, adding things to help supplement can be really helpful too. So maybe going on walks, doing something you enjoy doing, going for spa days, helping take care of yourself that way where you don't feel so deprived. And then preparing for that change. If you're going through this, you want to make sure that you're ready to go through it. Getting that support system, communicating with them what you need. If you need something, just ask them. Apologize ahead of time, because you probably will be cranky if you had to guess, probably. So apologizing ahead of time, then you don't have to worry about what they're thinking um, while you're going through withdrawal, and they can kind of know where you're going and kind of take everything with a grain of salt. Rallying a co-tobacco user to help kind of say, hey, let's do this together and hold each other accountable. Removing tobacco products from reach. And this, everybody's a little bit different. So some people this works and some people not. But again, trying to get rid of everything that's going to remind you of tobacco so that you don't have to see it. You don't have an extra one to go back to in case either. And then considering a written commitment, which kind of looks like this. On such and such a day at this time, I'm gonna be done. I'm not gonna use tobacco. So it creates accountability and can contribute to a higher success rate as well. And then challenges of stopping. Putting that smoking hand on the wheel if you're driving. If driving tends to be one of those places you tend to use, putting the smoking hand on the wheel, changing up your routine, changing up your music, getting your car and truck detailed, anything to kind of make you think a little bit harder before you just fall into that routine. Parties tend to be very difficult for a lot of people. So asking a non-tobacco friend to stay nearby and keeping a beverage with a straw in your hand, probably your hand that you usually use. Avoiding alcohol if possible, because alcohol tends to be a big time people fall back into old habits with tobacco, and bringing your nicotine replacement aid. Even if you haven't had to use it in a while, even if you don't think you need it, having it with you can help keep you from falling back into that habit. If it's at your workspace, taking water breaks, doing deep breathing exercises, continue to take those breaks outside so that you don't feel like you're missing out on that. And then around the house, maybe doing a deep cleaning, rugs, curtains, beddings, just to help clean the air. But also, sometimes that smells what kind of triggers people back into old habits. Keep dropping a former tobacco cash into a clear jar and buy something nice. I love this idea because then you can physically see that money, um, and maybe have a nice vacation, buy something you really wanted to have. Start a project that requires working with your hands so that you keep your hands busy. Sometimes it's just a matter of keeping your hands busy, having something to keep you moving, and then going to bed early. I will say nicotine does mess with the circadian rhythm, so it can alter your circadian rhythms when you sleep. So then going through withdrawal, a lot of times people can have sleep issues initially just because it impacts that circadian rhythm again. And it will get better, but it just takes time. And then relapses. So as I mentioned, when you stop, you can successfully stop tobacco many times. Falling down and getting back up is an important part of success in any manner. And so that's all the relapse is falling down and finding ways to get back up. Average number of attempts before you can successfully fully stop tobacco is about 6 to 7. But each attempt gets you closer to your chances of subsequent success and stopping for good and staying tobacco free. So it's an important part. A slip up is not a relapse, but it is going to help keep you going over the long run. Just keep getting back up and trying again. There are a lot of additional resources. We are going to have our tobacco cessation program with the city starting in February. So that is available to everyone. Even if you have a family, loved one, or someone that wants to hop in, happy to have them. Feel free to share the information. Just reach out to me. You can also use the National Network of Tobacco Cessation Hotline, which is 1-800-QUIT-NOW. They have a call service that can help you. Centers for Disease Control and Prevention has a quit smoking website. They have tips from former smokers as well. They have social groups that you can kind of talk to and get tips and tricks from people who used to smoke, support groups. Same thing on the US Department of Health and Human Services, smokefree.gov. They even have a text app for smokefree.gov that you can text to get help and support. And then GoodRx, great resource. They have an app and the website to help with medication copays. If you are on the city's insurance, we do have nicotine replacement aids in the dock that are going to be available to you as well. Um, so again, just looking at the tobacco facts, what are the facts of tobacco and the risks, as well as for hookah and marijuana? But are you ready to change? Are you ready to make that step? And then prepare to stop. Make sure that you're ready. Don't try to stop too soon. Setting a date is really important so that you can prepare. And some things to think about from today. Maybe if it's not you that's using, maybe your friend or loved one, write down the good and bad of stopping, or sit down with them and write down the good and bad of stopping and determine how ready they are. You can't force people to change if they're not ready. And if you're not ready to change or if it's not a good time, that's okay. But keep reevaluating where are you? Determine your why. What is your big motivation to change? And set a stop date. Review the tools that you need to stop. Talk to your friends and family. Talk to your provider. We're here and happy to help. If you have any questions, feel free to reach out. You will be getting this handout sent out to you as well. Thank you. And again, feel free to reach out to me at sarah.wiseman@eversidehealth.com.